So like, I thought about it, like getting violent, at least with my words. But then I realized over time that that's not going to be effective. So I need to find a way to be articulate and calm and, and cooperative. And eventually kept on looking at what is there to do about this. I mean, I'm not going to take down City Hall. I'm not going to take down psychopharmacology across the board. I'm not going to prove that they're inappropriate or ineffective. But what I can do when I started looking at it was realize that it's not the psychopharmacological problem. You see, no patient is being, very few patients and no outpatients are being held down and forced their medicines every day. People take their medicine because they think there's something wrong with them. What if people saw that there's nothing wrong with them? What if the general population got to believe that even when they're really, really uncomfortable, even when they're feeling miserable, even when they've experienced something unspeakable, even if they're in sheer pain, even if they're total discomfort and misery, what if they saw that that was essentially just a part of being a human being in this crazy, challenging world at the present time? And you're doing like all of us are doing, just making it through the world using whatever skill set and whatever habits and whatever ideas that you come up with to get through the day one at a time. If you could get people to see that there was nothing wrong with them, then they would immediately learn that there's no reason to take medicine. Because the only reason they take medicine is they're pretty sure that they got a condition that somebody told them they have, and they were willing to agree that they have it. So hence from that, I started taking people off of medicine a little bit more regularly. And I began to work around the world. I worked all over this United States, and I also worked overseas. I worked in London and Paris and Israel and a little bit even in Thailand, and began to really look at like, what can we do to help the situation? And really all that we can do, and that's the other thing is that psychiatry, the diagnoses in psychiatry are culturally specific. What looks like sick inside California doesn't even look sick inside Calgary sometimes, but certainly doesn't look sick inside of Singapore or Zimbabwe. It's a whole different game. You can have the exact same symptoms and be in Zimbabwe, and no one will even notice or even write you off at all as being sick. They might say you're sad, they might say you're afraid, or they might say you're a shaman. They might say anything. And because it's variable and there's no definition, because there's no variable, then there is no definition, which means that like when a word is different in different parts of the world, when an actual concept shifts, then it means that it doesn't have a pure definition. Without a pure definition, it is open to an entire paradigmatic shifting narrative conversation. We can shift the narrative on what mental illness is.